Welcome to the Spinal Truth Show Weekly Edition. We are here to answer your questions about your health journey that the current medical system is just failing at. I am Dr. Caleb Slater. I am your host. I am here with Chris, our videographer, producer, and we have a special guest for this episode and the next two episodes, my wife, Danielle Slater, who is our local women's health pelvic floor expert. So an expert in everything that has to do with the pelvic floor, men's health, women's health. She is the expert and she is here to talk about those subjects today and for the next two series.
Yes, thank you. I'm excited about this show.
So when people say, today's show is pregnancy. And I actually have a little bit different view when I hear pregnancy, and again, I'm orthopedics. So when I hear pregnancy, one of the first things that I think of is actually like carpal tunnel and neck pain. And I would say that that wouldn't be the case for most people, right? It's not even in the area of concern.
Sure.
But what happens is that a lot of women who are carrying for 9, 10 months, they start to get stuck in their lumbar spine into extension, and they have to move forward at their thoracic spine. They round a little bit more at their thoracic spine, so their upper back. They reach a little bit more forward with their neck. And during this time, a lot of women start to experience hand symptoms. And this is anything from your pain, numbness, tingling, weakness in your hands, specifically your middle finger to your thumb. But also they'll start to experience some like hot and cold changes in their arms. And this can be from this area as well. And this is something that I feel like a lot of women don't know, that why pregnancy causes this, why they're expected to get these symptoms afterwards, and what they could do for it, because a lot of people are still going the normal route of your stretches at your wrists that don't work for carpal tunnel, or eventually getting carpal tunnel release surgery where they didn't need it at all, and it was actually a neck problem and upper back problem. So you work with a lot of younger mothers, newer mothers, or right? What's the term for recent mother?
Yeah, postpartum.
Postpartum.
Or the fourth trimester.
The fourth trimester, so the one that never ends. So do you get a lot of these complaints, a lot of these patients coming in saying that their neck hurts, their shoulders hurt, they're getting pain down their arms?
Yeah, I think it's a higher prevalence in the postpartum population compared to pregnancy. And you got to think they're feeding their children, they're carrying their children, holding their children, picking them up. So they're always in that forward flexed position. And I see a lot of dismissive responses from their doctors about it'll just get better, it'll go away, or it's just normal.
Well, and it is normal, but it's treatable and it's easily treatable.
Common.
And you know what? And that's a better way of phrasing it. It's common, but it's not normal. It shouldn't happen. And honestly, a few simple exercises, doing some extensions on a foam roller, doing some cervical retractions, those two alone will take away, I'd say, 75% of the symptoms. And not only that, it'll show you that it's coming from your neck, coming from your spine, and it's not actually coming from your shoulder, your elbow, your wrist, where you're getting a lot of these symptoms. And just knowing what causes it too is helpful, because then it kind of, when you're in pain, and you just had a child, right? And you're having symptoms and you're waking up and you're tired and you're fatigued and you're stressed out, having symptoms that you don't know why, that's just another layer on top of it that you don't need. And I don't understand why a lot of these patients aren't getting the proper information, where we know that it's an upper back neck issue and it's pretty easy to address. And honestly, you should start addressing it sooner than postpartum.
Oh, it's so much easier to treat. We both have seen it when someone has symptoms for a few days or a week compared to this has been going on for 5 years. Can you please fix me today?
Right, and it's a lot harder. And those 5 years too, where they've gotten bad treatment in the wrong area. So they go to the physical therapist, and the physical therapist does a lot of stretching at the wrist. They do ultrasound laser at the wrist. They do some Graston. It doesn't work. They get some cortisone injections. It doesn't work. And then eventually they get surgery, and that doesn't work. And now they're surgically altered. Maybe there's scar tissue. They still have symptoms, and those symptoms have been consistent and or worsening over the years. And now it's a little bit harder to treat.
Yeah, I think there's definitely a cultural problem too, where moms are just like everyone asks you about the baby after you have a mom. Not a lot of people even ask you about how you're doing or prioritize care for you. So you're like hyper focused on my baby instead of, hey, I just went through something extremely major. And any other time you would get a knee replacement, a hysterectomy, something, you would have rest, you would have recovery, you would have PT, but you have a baby and it's just kind of like washed under that you're supposed to recover, where there are so many resources that you could utilize, but no one's guiding you there. Or
And when you think of having a baby, you think of trauma, birth trauma, right? But it was actually slow and steady trauma for 10 months before that.
More often
is
the case.
Being a little hyperbolic, but I mean, for at least maybe like 5-6 months, you're distending your abdomen. You're putting pressure on your back, which is shortening, which is going more into lordosis, so extending your back. Your ligaments are shortening in your back. Your muscles and tendons are elongating in the front, right? You're putting more stress on your upper back, your shoulders, your neck. Then you deliver, which is trauma in and of itself. And now you kind of have the added trauma of caring for a heavy 10 to 20 pound baby over the next, 2 years that you spend primarily carrying and holding it and breastfeeding and picking it up out of the crib, while your lower back is weak and unprotected because the muscles are elongated and you didn't do anything to fix them, partly because you didn't know why or how. And the other part is because you're tired and you don't have as much energy in order to do so.
Sure.
And just to back up some of your claims here, because I just found a study from 2015 that says while carpal tunnel occurs in about 4% of the general population, 31 to 62% of pregnant women are estimated to be diagnosed with carpal tunnel during their pregnancy.
Wow, that is a great stat.
And then after a pregnancy, it can be almost 30% of women may develop carpal tunnel syndrome.
Right, and why do they develop carpal tunnel? Are they out jackhammering after they've had a baby? And if you look up under the current medical system, like if you Google what causes carpal tunnel, it'll be computer work, right? Are they doing more computer work because they have a baby? No. So it's not your wrists. And we've done series on this. We're trying to get this information out there. It's so well known to us that it's not your wrists. And that's your grandfather's way of looking at it. It's your neck. It's coming from your spine. Your carpal tunnel is an irritation of the median nerve. The median nerve starts at your neck. It's an irritation higher up that's causing symptoms further down, and that's what kind of gets convoluted in the medical diagnostic process. Is they just look at where you say you have symptoms. And that's what we're trying to really get the information out there, is that there's a better way. First you want to look and see if it could be coming from your spine, and it's pretty obvious with these population that it is. So that talks about carpal tunnel. That's something that you wouldn't really think about when you hear pregnancy. Something that you would think about when you hear pregnancy is sciatica, lower back pain, right? I mean,
inevitably,
yeah.
yes.
I don't know what the percentage is on that, but let's say 100. It's pretty high. And what causes that is what we just talked about. The baby is slowly growing. And what happens is that it puts more weight and more pressure in the front. This distends the muscles. So the muscles start to elongate. Elongated muscles become weak. What also happens too is that on the other side of your spine, those muscles and tendons and ligaments and fascia and joint capsules, they shorten because they're stuck in that extension position. So they shorten and they become stiff. Now that puts a lot of pressure on not only the joints, so that's why you get some of your local back pain, but also some of the nerves that are coming out of your spine. And that's why you get pain running down your legs. So that's why you actually get sciatica. And a lot of times the baby gets blamed for putting pressure on the nerve. And I'm not saying that can't happen, but I'm saying more likely is that it's actually your back, the position that your back's in, that you can't get out of too. So it's really, really hard to get out of that position while you're pregnant. The further along that you go in pregnancy, it's pretty much impossible to get out of that position. So you're putting pressure on that nerve, and that's actually what's causing sciatica. And people will say it'll go away once you deliver, which it might diminish, but often you see new moms with lower back pain or sciatica pain for like after they've delivered, or a few weeks or months after they've delivered, or even a year or so after they delivered, because they never fixed that imbalance. And I think it's really, really easy to fix. And it's another thing that I don't understand why we don't do it better in our current medical system.
Yeah, it's so frustrating. I think it's dismissed a lot. as just being, it's just so common that the doctors just say, it'll get better, it'll get better.
Well, and I like the way you phrase it. It's common, but it's not normal. It's a symptom, and what you should address the underlying cause, not just wait for the symptom to quote unquote go away, which is really you just getting used to it.
Yeah.
Question for you about that, because pregnancy is a temporary thing. It lasts, 10 months, potentially 9 months, and then it's out, and you're recovering from there. So are they treating it and looking at this knowing that this is just a temporary pain that you're going to have that'll subside or potentially should subside after the baby comes out?
So it's a good question because the pregnancy itself is temporary, but the effects are lasting. So I use an analogy with patients where snow builds on a small tree and tilts it over. The snow melts the next day, the tree's right back up, no big deal, right? Now snow builds on that tree, tilts it over, stays there for the winter. Now the snow melts at the end of winter. What happens to that tree? The tree's stuck there because so much pressure was on it over the course of time that it deformed. It grew in that position, right? Or it stayed in that position. That's actually what happens to our spine, is so much force over a long enough time is present. Additionally, your spine isn't able to move in one specific direction. You're not able to bend forward. So you're not able to get it out of that position. You're not able to contract the muscles on the front. You're not able to stretch the muscles, tendons, ligaments of the back. So even though pregnancy itself is temporary, the effects of it can be permanent. So it's a good question because I think that's the way the doctors typically look at especially when you go to the OB, and please you speak to this better than I can, but like if you mention anything that isn't really directly about the baby, it's pretty much dismissed.
Yeah, I feel like they're there to ensure you're going to survive and everything's going to be healthy, but not that you're going to thrive always. And I don't think they really have the time to be able to do that given our current medical system, insurance-based.
What would you say your average time with a doctor was when you went?
For my OB visits, 5 minutes.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show. And you kind of extrapolate that. Let's say they see one patient every 10 minutes, right? They're seeing 6 an hour.
And they have to document about that patient before they're going to see the next one, order any tests. And It's just kind of a hectic thing. They don't have time to help you be at your best and acknowledge things that aren't life-threatening, so to speak, although sciatic pain can make you miss work.
It can mess up your life. Get in the way of you caring for your child. A lot of women have trouble picking their baby up out of the crib. And we're not just talking about women who have had a cesarean. We're talking about, or they had a cesarean and they've recovered from that. They still have a problem or difficulty, or they're fearful or hesitant about getting their baby up out of the crib because they're not really sure that their back's going to be there for them.
Yeah, and I think common responses, like you say you have back pain, you're given medication or told to be on rest, and you avoid the movements that create back pain. But in doing that, you probably avoid like healthy motion that your body needs. You start to restrict yourself, and all of a sudden down the line, now you can't move and bend the same way you used to because that pain wasn't handled correctly.
Yeah, and so for the people listening to this, if I was listening to this, I'd be like, all right, well, so what's the better way? What's the better way? And it's pretty simple. I think we've made medicine, especially physical medicine, more complicated than what we needed to. So we do, in the medical field right now, like if you go to see a chiropractor or a PT specifically, they're going to do a lot of like pelvic floor related exercises. They're going to do your Kegels. They're going to do your hip exercises and stability training. They're going to do your core neutral. They're going to do some diaphragmatic breathing and maybe some bird dog if you're able to do it. A lot of core neutral stability. I hate that.
They're going to stay safe.
They're going to stay safe. I hate it. Why? because you're not staying core neutral throughout your day. You need to be able to be strong and flexible in the range to be able to bend down and pick up something off the floor, pick up your baby, pick up your child from the crib, right? Like, put them in that stupid car seat that is so hard to get in the car in the first place and is horrible to be able to reach through because you have to bend, reach, and twist.
No,
and the
you
kids
said pick up a 10-pound baby, but you had the car seat.
Yeah, the car seat, and
No.
you had a lever arm, and it's a 60-pound baby. And then you had screaming and kicking in there. And so anyway, so what's the right answer? The right answer isn't core neutral stability. So if you're out there and you're getting bird dogs as the answer, and you're getting like diaphragmatic breathing and stuff like that, you're getting the wrong treatment. Or at the very least, it's not the most right treatment. It's not the most effective treatment.
It's like the icing on the cake, maybe at the very end, what you could do to, I don't know, help with other things. But in terms of getting those muscles to turn on better, you to move better, that stuff's not going to help.
Maybe, but I'm busy, right? I have a job. I have kids. I don't have enough time to ice the cake of my back.
You don't want to do an hour of exercises?
Right. I don't want to do exercises that are actually helpful and then another 30 minutes of exercises that are kind of helpful, but I don't really need them. I just want, what do I need? What is the bare minimum that I need that is going to get me better and strong? And so step one is mobilizing your spine into flexion, moving your spine through the full range of flexion, restoring the motion that you weren't able to do for the last maybe 5 months or longer while you were pregnant. So restoring that motion. And so a simple exercise like a happy baby or a double kneaded chest stretch is a nice way to start because it's more of your safe flexion, but then progressing to something like a Jefferson curl where you're holding a weight and you're bending down, standing, and you're trying to roll your spine segmentally into flexion. That is a great exercise that I like to do for these patients. You have to start slow because like what you said, it's not a safe exercise in the sense that it's aggressive, right? And if you've just had a child, it's probably not the one that you want to start with, or if you do, you want to start with minimal weight to no weight. But you want to progress to something about, I've had patients your size progress to 60 pounds, and think about how strong their back is that they can segmentally roll down with 60 pounds. And this is a 5'3", 120-pound woman, right? So that creates the motion. The happy baby, double kneaded chest, the Jefferson curl, that creates the motion. But motion will make you feel better, but motion won't keep you better, and motion won't keep you stable. So now you need strength in that range. And a simple exercise is basically like a reverse curl. Lay on your back, actively bring your knees to your chest and squeeze. Don't use your hands, just use your muscles. Now you've squeezed.
Squeeze what?
You're squeezing your abs. So you're using your abs and your hip flexors in a range of lumbar flexion, okay? And you want to do that. The best way to strengthen and remodel tissue is end range muscle contraction to fatigue. So whatever that means to you, if it's 3 at first, great, but you want to work up to being able to do about 15, 2 sets of 15, and you do that once a day. If between those 2 exercises that I outline, that's going to take care of 90-95% of a lot of the problems for people that have lower back pain due to pregnancy-related issues.
Yeah, and I feel like it's going to start to turn on those abdominal muscles again,
Well,
which is a major thing that I see is complaints of abdominal separation, the DRA or diastasis recti.
Well, and think about this. So you're talking about the diastasis recti, but maybe even something like, let's talk about like losing that little belly fat, right? A lot of women complain that they can't lose that. And why can't they? And obviously your life got turned upside down, so you can do the stress, not sleeping, stuff like that. And that's definitely part of it. But one of it is that you actually can't contract those muscles because your spine is stuck into extension. So if you picture your bicep, right? Let's say I tell you to strengthen your bicep, but your elbow is locked straight. Whatever you do, you are not going to be able to contract that bicep maybe by 5% of what it's able to do because your elbow is locked. Your bicep is supposed to move your elbow into flexion in order to contract it. That's what a bicep curl is, right? Well, so if I want you to properly strengthen your bicep, I need you to move your elbow. So step 1 is getting you to move your elbow if it's stiff. Then I can get you to properly strengthen and contract your bicep through its range. Now you can contract it. So that's what happens with a lot of these women who for 5-6 months, their back is stuck into extension. Now they go do a whole bunch of ab training, but they can't really contract their abs because their spine is rigid. Their spine is stuck in extension, so it's not moving. So even if you could contract your abs, which is hard because they've been elongated, they've been lengthened, which makes them weak, even if you could contract them, you're not going to contract them too far into range because your spine won't move. So step one is to get your spine to move. Then step two is to strengthen through that range. And that's another good way of addressing that diastasis recti that you're talking about. If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
I was just going to take the time, since we're getting close to the end of the episode here, and I think we'd be remiss to not ask our pelvic floor specialist some questions we had from TikTok in regards to some pelvic floor stuff.
Good. I think I've talked too much during our pregnancy.
You always talk too much, but
right.
It's okay.
Well, this month we've been covering a lot of bladder issues on the TikTok and on our Instagram, so we had a lot of questions in regards to that. This one from Tanya Bronco says, which disc is responsible for bladder weakness?
That's a great question. And I don't think we consider it to be a disc that's related to the weakness, but maybe a position of the disc pressing on the nerve that innervates the bladder. So your lower thoracic region has nerve innervation. So there's multiple levels throughout the spine, a lot of redundancy in our spine that give nerves through multiple vertebral levels to organs, to muscles. So that lower thoracic area has a lot of communication with the bladder. So if you're having a disc protrusion in that region and it's pressing on the nerve, then it can subsequently contribute to bladder dysfunction in that area.
Yeah, and I think that's just a better way of phrasing that would be what nerve, not what disc. So if it's a disc issue, the disc is pushing on the nerve. And I just did a quick Google search here, and T11 to L2. So basically it's where the lower thoracic spine, like what you said, to the upper lumbar spine, that has innervations to the bladder, and that affects the detrusor muscle. So that's the muscle
of the bladder.
Yeah, so can you tell us what the detrusor muscle is and what it does? Because this is the area of your spine, or part of the area of your spine, that innervates this muscle.
Yeah, it's that is the muscle that composes the bladder, but it's an involuntary muscle. So you can tell your pelvic floor to contract, right? If you feel like you need to go to the bathroom, but you're not at a toilet, you can hold and squeeze tight till you can make it there if you have enough strength.
Sometimes.
Yeah, hopefully. But with your bladder, you can't tell it to hold tight or to relax. It's innervated by complex communication from the spine, from the brain, has a very dense network of nerves that are communicating.
So it's reliant on that nerve signal transmitting properly, not your ability to control it.
Yes.
So if that nerve signal isn't transmitting properly, it's going to malfunction. So that detrusor muscle now might contract when it shouldn't, might not contract when it should. And this is what we're trying to tell people. This is what we found clinically more often than not. And we're not talking about sometimes, we're not talking about once in a while, we're talking about almost all the time, that these patients have a problem in this area, this level, right? T11 to L2, this area of their spine, the TL junction. There's a problem there. There's pressure getting put on the nerve signal is getting changed. It's less, it's spastic, it's intermittent, however you want to phrase it. And now that nerve signal isn't getting to the area of your problem. And let's say for bladder pain, for overactive bladder, for interstitial cystitis, it's this nerve not getting to this muscle. And that causes all of these symptoms that get misdiagnosed as possibly an underlying disease like interstitial cystitis. And the treatment is medication-based, heavily medication-based, possibly even surgical-based, and it's physical therapy-based, but under the typical approach, which is your down training, your pelvic floor.
It's impressive terminology.
Right? I know I'm married to a pelvic floor expert. So the typical approach just isn't effective. And it makes sense why it's not effective, because they're looking in the wrong area, they're treating the wrong area, they're treating the symptom, not the cause.
Yeah, and it's interesting because we both come to this conclusion from different angles. Felt like you were treating people orthopedically for back pain. And then later down the line, a few weeks, they would tell you, and you would tell me stories about this. They said, you know what, I was having this bladder symptom and it went away. And I didn't even expect, I didn't even tell you about it because I didn't think there was anything you could do for it. And then by the same aspect, I still remember taking my first course about the spine, and they're expressing the spine can contribute to pain in the knee, even when there's not back pain because of limitations on stiffness and the nerve. And it lit up in my head. If it can be causing pain throughout the rest of the body, why can't it be contributing to pelvic symptoms, to internal symptoms? So I felt like we both found this around the same time, but from different avenues.
So we kind of met in the middle. You worked bottom up, I worked top down.
Yes.
Is that the?
Yeah.
Well, and it's funny you say, so a lot of the stuff that I started doing because patients would tell me my symptom of brain fog went away, my symptom of my bladder went away. And you know how you said that the doctor would just kind of dismiss when you would go with symptoms? I would kind of dismiss when a patient would say their symptom improved when it wasn't the symptom that I was treating. But over and over and over again, at a certain point, you start to maybe listen a little bit more. It's not a one-off. It's not somebody saying something that could have just been happenstance, right? It happens so consistently that now you start to put it together. You start to cluster, these patients with these symptoms, with this area of problem in their spine, and now you start to see it. But it took a while to do that. But since we started doing that, I've never been more successful at treating these type of conditions, and among others, these type of symptoms. And the cool thing is that now we're actually explaining it for me, for my aspect, in a more logical way. We're explaining it where if you look up what causes overactive bladder, if you look up what causes bladder pain or interstitial cystitis, one of the main causes is idiopathic, which is medical speak for I don't know. So why doesn't the medical system know? And it's very likely that they're viewing this problem wrong. And so often the case, we see it's a problem from the spine, and nobody's telling people this, nobody's looking for this, nobody's treating it, and that's why people aren't getting better.
So we do have a few questions here and maybe some controversial takes, but this may have kind of already been answered by you, Caleb, but this one person responded to the video about interstitial cystitis, which I have trouble saying, saying that, so pelvic floor PTs are bad, ?
Ooh. You know what? Yes.
Someone's sleeping on the couch tonight, guys.
No.
You've said that you've never been more successful than when you started treating the spine. And so again, are pelvic floor PTs bad? No. But I think PTs in general are treating wrong. They're treating the symptoms just like the medical system does. And they're at least treating the symptoms with exercise, stretch, contraction. They're trying to get those areas to heal, and they're not just masking it with medications, injections, right? So that's a better approach in my mind. But it's a pretty ineffective approach for a lot of symptoms and conditions. Pelvic floor being one, if not one of the major ones. So I want to see pelvic floor therapy change to where they map out your symptoms. They talk about how often you go, how much pain you have, in what area, when, how often it occurs throughout the day, how long it lasts, what you need to do for it, what exercises or movements that you can do that make it better or worse. And then they look at your spine. And they see if they see an area of your spine that could explain your symptoms, if it's stiff, if it's painful, If working on mobilizing it, showing you how to mobilize it, showing you how to strengthen that area, if that changes your symptoms, well then I think that's a pretty easy cause and effect that you found the underlying cause. And that's what we do here, and that's the way I want to see our profession and pelvic floor go to.
Sure. So I think the better answer is not, they're not bad, but are
they're
they
ineffective.
as effective as they could be? And not always.
Well, you know what? Then if I'm spending my time and money, especially if I'm a young mom, right, where you have what, an hour and a half with that kid before you have to feed them again, right? So you have 20 minutes to drive there, you have an hour visit, let's say 45-minute visit, then you have 20 minutes to get home. That's if everything goes well. That's if that kid behaves during that time and they're not crying in the clinic, right? Or that's if you timed it out well, where you were able to feed them right before you leave and right when you get home, or if you were able to find a sitter that didn't cancel on you in the last. So like you talk about what ineffective means when you're a new parent. Ineffective means messing up your life for maybe no reason, right? 20, 30 visits of going to this place, of all these stressful visits because you have to get the kid ready, you have to plan it out, there's a certain amount of time, you have to find somebody to watch your child. If you're not bringing your child, you have to rush home to feed them. 20, 30 visits, paying your copay and suffering this unnecessary hassle where it's ultimately ineffective. Yeah, I would say that's bad.
The system is bad, not the
Sure,
the
and
PT.
I write about this in the book, that it's not like these practitioners are out there doing something malicious. They're not treating you improperly because they don't know any better. They don't know the difference. And this is still very new. And like what you said, McKenzie physical therapy has been around since the 80s. They kind of pioneered treating the spine to treat your knee pain, to treat your foot pain, to treat your elbow pain, right? They kind of pioneered this, but they didn't take it further to say that if we know your spine can cause a joint issue and it can be misdiagnosed, and it's often misdiagnosed, then how come we didn't think your spine can cause other issues that are misdiagnosed? And that's kind of what we found, and that's what I think is special about the Spinal Truth, is that we're treating stuff like Crohn's and ulcerative colitis and overactive bladder and interstitial cystitis and all of these conditions, brain fog that don't really have an underlying cause. If you Google it right now, they don't have a great underlying cause. They'll give you probably 8 different causes or supposed causes for all of these conditions, but one of them is going to be I don't know in addition, and that's the main one. So all of these symptoms that we found that are misdiagnosed and improperly treated in the current medical system.
Sounds like that's a wrap for today.
Yeah. Well, thank you for watching. That was our show, The Spinal Truth, our weekly edition, talking about pregnancy-related issues. Next week, we're going to talk about men's health with our local expert, our pelvic floor therapist. If you are listening and you want to ask us a question and you want us to answer on the show, leave a comment down below. You can also catch us on TikTok, Instagram, Facebook, and YouTube. If you want to send us a comment, we will do our best to answer your question. If you want an appointment, you can go to thespinaltruth.com. You can either do a 30-minute consultation or get an appointment, and you can pick our brains about the way we see things a little bit different, that we've seen to be so much more effective in our career by looking at the spine, looking for the underlying cause, not just managing your symptoms. Stay tuned for next week.